But first off, I just wanted to mention something. We talked about the challenge of trying to diagnose bipolar disorder, especially in people that have bipolar 2 or people that have bipolar but they have yet to show any manic symptoms. And if you remember, that's the majority. Actually, people, their first episodes are depression. But I want to say that sometimes making a diagnosis of bipolar disorder is easy. And I want to give you a case vignette. I was at Kaiser many years ago, and it just so happened I was running a depression group, and at the same time they were running a bipolar medication check group. And so anyway, I'm up there talking. It was psychoeducational group, and this man comes in, and they have these chairs you can stack on top of one another. So he came in like 10 minutes after the group started, and he stacked about 8 of these chairs on top of one another, and then he climbed up on top and said, "Excuse me, but could I show everybody these pictures of these mountains?" He said, "I'm going to climb every one of these mountains." And so I said, "Excuse me, sir, but is it possible that you are actually here at Kaiser to go to the group for people with bipolar disorder?" And he goes, "Yes, how did you know?" So sometimes it's a cinch. Okay, all right. Also, I have never done this before, but I'm going to do this right now. I'm going to, I've never done it before in a class. I'm going to promote one of my books, okay? And I'll tell you why. And you don't have to buy it, but I just want you to know about it. I'll put it out here, you can take a look at it. But this is Simon & Schuster. We got a really great deal with them. This book costs $7.95. And you can hardly ever find $7.95 books, and they were willing to really discount this hugely because it's for consumers. And it turns out that the editor that I worked with has a child who has mental illness, and so she was just really on board about this. And I just believe so strongly that people have a right to know about treatments, and as we're finding out, a lot of these treatments are not, a panacea. They're not. They save lives many times. They reduce suffering. There's obviously a place for that, but they have side effects. And this kind of thing, I hear this over and over again when I give talks, especially to lay audiences. Well, I have all these side effects, and I talk to my doctor, and he says, "Well, you just have to deal with it. Just have to deal with it." And the sort of the powerful doctor, passive patient kind of thing. It's not appropriate for anybody, but especially when people have mental illnesses. They feel so out of control and disenfranchised, by their illness. To be treated in a way like that, I think it's just inappropriate. So anyway, in any event, there are several of these books out there for consumers, but most of them cost about $30. So that's it. That's my one and only advertisement that
Is it good?
Because I think people have a right to know. Okay, so I wanted to mention also before we start talking about anxiety disorders in children, and this will actually be relatively brief because we've cut a lot of what we talked about last week with adults, and at least the anxiety disorders are true for kids. But there was this new study that came out, and I left this at home. So if you want the reference, you can let me know. But it's a study that shows pretty significant effectiveness in using morphine, moderate high-dose morphine, in people that have had physical injuries, but also encountered really horrific situations in Afghanistan and Iraq, and using morphine to reduce the likelihood of developing PTSD, and it's statistically significantly better than using just a little bit of morphine or using some other kinds of pain medication. And there was a study that was done almost 10 years ago where they used aggressive pain management to treat children who had very serious burns. And having extraordinary pain itself is obviously, it's tremendously traumatic, and especially for kids. But so anyway, that's just we can maybe add that to the list of at least experimental treatments for people who have PTSD, or excuse me, they have traumatic events that are accompanied by significant pain, is to be even more attuned to and more aggressive in treating the pain. So I just want to mention that. Okay, so as I said, right now I'd just like to ask if you have any questions as you've been reviewing things for the exam. We can take some time to address that before we jump in and do other stuff. Yeah?
For kids with bipolar, what do you treat with? I remember you said Seroquel for the like undefined stuff, but kids with bipolar, what was the...
Okay, well, first off, I hope I got the message across very clearly that there's a whole bunch of kids that have diverse psychiatric problems that oftentimes are called bipolar, and sometimes they really are, but likelihood is a lot of them really don't have, true bipolar. They have affect instability that is very significant. But for those kids that have bipolar disorder, and kids, I mean pre-adolescent kids, it looks like most of the research has shown that Depakote plus lithium is the most effective combination, but it's not very effective. I mean, remember we had I think the slide said 40% of kids respond to that combination, and that's certainly nothing to write home about. So the most recent material that's come out of the Stanley Foundation and NIMH for treating bipolar in kids is the use of Seroquel. And the reason for this is with bipolar disorder, ultimately, a huge issue is long-term tolerability. And we've talked about this before, but this is going to make it or break it in terms of the person's life, quality of life. And so looking for efficacy is one thing, but you also got to find something that people are willing to take and, without suffering too much in terms of side effects. So looking both at efficacy and tolerability, Seroquel is probably, the front runner with kids. It may actually turn out to be a front runner with teenagers and adults too. But remember that Seroquel is kind of a multi-purpose drug. It targets psychotic symptoms, it's anti-manic, it treats bipolar depression, it's prophylactic use in preventing depressions and mania looks good. What are the downsides? Metabolic syndrome, okay, and especially weight gain, but the other things we talked about too, increase in blood fats, triglycerides, cholesterol, stuff like that, tend to be seen more frequently in kids than in adults. And, it's one thing to look at acute onset side effects, which obviously make a big difference whether people take the medicine or not. But we really have to have an eye towards, but what's going to happen to this kid, when they're 30 or 40 if they've been exposed to a drug and they have had uncontrolled blood glucose levels or stuff like that. So I think that it's probably a good choice, but it really, like all these bipolar medications, needs to be monitored medically, to make sure the kids aren't gaining too much weight, or that you're not showing signs of type 2 diabetes and stuff like that. Okay, so that's probably, but that's subject to change. I swear every year they come out with new treatment guidelines with bipolar, and that's probably a marker of the fact that it's hard to treat, and they haven't discovered drugs that are as effective as with other psychiatric disorders. Okay. Other questions? Yeah.
I was looking at Neurontin, and the slide says it's not effective
For mania.
for mania.
Right.
So, is it used for bipolar or?
It's often used. Okay, so the question is about Neurontin, and it's used a lot in bipolar, even though it's not effective at all for treating mania. But it's used to treat comorbid problems, especially anxiety disorders. Neurontin is pretty successful in treating the whole spectrum of anxiety disorders, with the exception of OCD. Okay, it does not treat OCD. Okay, it treats certain kinds of pain conditions. So that's another benefit. And then also, there's some evidence. It's not strong, but there is some evidence that people that are in recovery from substance abuse problems, if they take this, then the time to relapse of drinking behavior again or something like that is longer, so it helps to maintain abstinence. The other important feature about Neurontin is that, if you remember, there's a large number of people, around up to 70% of people with bipolar have significant substance abuse problems, as we talked about. That's really got to be addressed or you don't have good outcomes. And yet, you know, you don't want to give somebody with substance abuse history, you don't want to give them benzodiazepines. So Neurontin is an anti-anxiety drug that, number one, doesn't cause dependency problems like you might with the benzodiazepine. And secondly, the major group of drugs used to treat anxiety disorders are antidepressants. And you know, it's like we talked about before, they can really destabilize bipolar. So that's why it's used a lot, okay?
So, but for mania, if there's manic symptoms, it's not going to...
It's not effective at all. That was the one, I'm pretty sure I mentioned this, the 3 studies were, 2 of them that's no better than placebo, and 1 of them placebo actually was better than Neurontin. So, so it's an add-on drug. When you say people have bipolar, on average, those people that are successfully treated in the United States that maintain stability are on an average of 4 drugs. Oftentimes, Neurontin may be a part of that package. Okay.
Thank you.
Yeah, you betcha.